Hello, and welcome to another video here on Vital Her. I'm so glad you're here with me today. My name is Dr. Mary Williams, and I'm a board-certified gynecologist with over 15 years of experience caring for women through every stage of their lives. I've dedicated my career to women's intimate health, and I'm passionate about making sure every woman has access to the information she needs to take control of her well-being. Today, I want to talk to you about something that genuinely keeps me up at night as a physician. In my practice, I'm seeing an alarming trend that's putting women's lives at risk. Too many of my patients believe that once they go through menopause, their gynecological health becomes less important. Some even think they can stop seeing their gynecologist altogether. This couldn't be further from the truth, and frankly, it's a dangerous misconception that I see affecting women across America. I decided to make this video because just this month, I've had 3 patients come to me with advanced conditions that could have been caught early with regular checkups. These are smart, educated women who simply thought they didn't need gynecological care anymore after menopause. In today's video, I'm going to break this down into 2 important chapters. First, I'll explain exactly why post-menopausal women actually need more gynecological attention, not less. Then, I'll walk you through what your post-menopausal care should look like and how to advocate for yourself with your healthcare providers. Let me start with a story that perfectly illustrates why this topic is so critical. Just last month, I had a patient I'll call Sarah, a vibrant 58-year-old teacher who hadn't seen a gynecologist in 4 years. She came to me only because her daughter insisted after Sarah mentioned some mild bloating that just wouldn't go away. During her exam, I discovered what turned out to be early-stage ovarian cancer. Sarah looked at me with tears in her eyes and said, "Dr. Williams, I thought I was done with all this after menopause. I had no idea I still needed to come in." Sarah's story isn't unique. According to the American Cancer Society, about 75% of ovarian cancers occur in women over 55, with the highest rates in women over 65. Yet, these are exactly the women who are most likely to skip their gynecological appointments. Here's what's happening. Many women associate gynecological care primarily with reproductive health, periods, pregnancy, birth control. So when menopause ends their reproductive years, they assume their gynecological health concerns end too. This is a fundamental misunderstanding of what gynecological care actually encompasses. Post-menopausal women face unique health challenges that require specialized attention. First, let's talk about cancer risks. After menopause, your risk for several gynecological cancers actually increases. Endometrial cancer, for instance, has a median age of diagnosis of 62. Ovarian cancer typically develops in women between 55 and 64. Cervical cancer, while preventable with regular screening, can still occur in post-menopausal women, especially those who haven't had consistent pap smears throughout their lives. But it's not just about cancer. The hormonal changes that occur after menopause create a cascade of health issues that many women don't realize are gynecological in nature. Take vaginal atrophy, for example. This affects up to 50% of post-menopausal women, but often goes undiagnosed because women are too embarrassed to discuss it, or they don't realize it's treatable. Let me tell you about another patient, Maria, age 63, who came to me complaining of recurrent urinary tract infections. She'd been to her primary care doctor multiple times, taking antibiotic after antibiotic. When I examined her, I found severe vaginal atrophy that was causing her symptoms. With proper treatment, her UTIs disappeared completely. She'd suffered for 2 years with a completely treatable condition simply because she hadn't been seeing a gynecologist. The statistics are sobering. Research shows that women who stop gynecological care after menopause are 40% more likely to have advanced stage cancers when they're finally diagnosed. They're also more likely to suffer from treatable conditions like pelvic organ prolapse, which affects up to 40% of post-menopausal women. Here's another critical point. Cardiovascular disease becomes the leading cause of death in post-menopausal women, and your gynecologist plays a crucial role in this prevention. We're trained to recognize how hormonal changes affect your cardiovascular system and can work with your other doctors to optimize your overall health. Before I continue, I want to pause here and ask you to do something really important for me. If you're finding this information valuable, please hit that subscribe button right now. Your subscription helps me continue creating content about women's intimate health, topics that are often overlooked but so crucial for your well-being. Also, please leave a comment below sharing your thoughts or any questions you might have. And if you know other women who might benefit from this information, please share this video with them. Your engagement really helps me reach more women who need this information. Now, let's talk about the warning signs that too many postmenopausal women ignore. Any postmenopausal bleeding, and I mean any, should be evaluated immediately. This includes spotting, light bleeding, or even just pink discharge. While it's not always cancer, postmenopausal bleeding can be the first sign of endometrial cancer, and early detection is crucial. Persistent bloating that doesn't improve with dietary changes should also raise red flags. I've had patients dismiss this as just getting older or slowing metabolism, but persistent bloating can be an early sign of ovarian cancer. Changes in urinary patterns, frequent infections, urgency, or incontinence often get attributed to normal aging when they're actually treatable gynecological issues. Pelvic pain or pressure that doesn't resolve should never be ignored. Here's something that might surprise you. Changes in your bowel movements can actually indicate gynecological problems. Conditions like pelvic organ prolapse can affect bowel function, and endometriosis doesn't stop being problematic just because you've reached menopause. The bottom line is this: your gynecological health doesn't pause for menopause. In fact, it requires more attention, not less. Your postmenopausal years should be some of the best years of your life, but that only happens when you're proactive about your healthcare. Now that we've established why postmenopausal gynecological care is so critical, let's talk about what this care should actually look like and how you can advocate for yourself. First, let's address the elephant in the room. Many women avoid gynecological care after menopause because they assume it will be uncomfortable or unnecessary. I want to assure you that postmenopausal gynecological exams can be modified to be more comfortable, and they're absolutely necessary for your health. Here's what your postmenopausal gynecological care should include. You should still have annual well-woman visits, even if you're not having any symptoms. These visits should include a pelvic exam, breast exam, and discussions about any changes you're experiencing. Depending on your age and risk factors, you may still need pap smears. The current guidelines suggest that if you've had normal pap smears and are over 65, you may be able to stop cervical cancer screening. But this decision should be made with your doctor based on your individual history. Let me tell you about my patient Jennifer, who's 67 and initially resisted continuing her gynecological care. She said, "Dr. Williams, I've been married to the same man for 40 years, and we're not sexually active anymore. Why do I need these exams?" I explained that gynecological health encompasses so much more than sexual health. During her exam, I discovered early signs of pelvic organ prolapse that, if left untreated, would have significantly impacted her quality of life. We were able to address it with non-surgical treatments, and Jennifer now says her annual visits are non-negotiable. When you go for your postmenopausal care, be prepared to discuss symptoms you might be experiencing. This includes changes in sleep patterns, mood changes, hot flashes, night sweats, vaginal dryness, changes in libido, or any physical discomfort. Many women think these are just part of aging, but many of these symptoms are treatable. Let's talk about hormone therapy for a moment. This is a complex topic that's often misunderstood. The Women's Health Initiative study from 2002 scared many women away from hormone therapy, but the medical community has learned a lot since then. For many women, the benefits of hormone therapy outweigh the risks, especially when started within 10 years of menopause. This is a conversation you should have with your gynecologist, not something to decide based on internet research or friends' experiences. Here's a crucial point about advocating for yourself. If you're experiencing symptoms that are affecting your quality of life, don't let anyone, including healthcare providers, dismiss them as normal aging. While some changes are indeed normal, many are treatable. If your first doctor doesn't take your concerns seriously, seek a second opinion. I want to address some common myths I hear from patients. Myth number 1, I don't need pap smears anymore. While the frequency may decrease, many postmenopausal women still need cervical cancer screening. Myth number 2, hormone therapy is too dangerous. For many women, the benefits outweigh the risks, especially when properly managed. Myth number 3, sexual health isn't important after menopause. Your sexual health remains important throughout your life, and many postmenopausal sexual concerns are treatable. Let me share another patient story. Eleanor, age 71, came to me because she was having severe pelvic pain that was affecting her ability to enjoy time with her grandchildren. Her primary care doctor had told her it was just arthritis. During my examination, I discovered she had severe pelvic organ prolapse that was completely treatable. After a simple pessary fitting, Eleanor was pain-free and back to chasing her grandchildren around the park. Now, let's discuss prevention strategies. Maintaining a healthy weight becomes even more important after menopause because estrogen loss affects how your body stores fat. Regular exercise, particularly weight-bearing exercise, is crucial for bone health and overall well-being. A healthy diet rich in calcium and vitamin D supports bone health, while limiting processed foods can help with weight management and reduce inflammation. Kegel exercises become increasingly important after menopause to maintain pelvic floor strength. Many women think Kegels are only for pregnancy and childbirth, but they're actually crucial for preventing incontinence and pelvic organ prolapse as we age. Here's what I want you to do after watching this video. If you haven't seen a gynecologist in over a year, schedule an appointment. If you're experiencing any symptoms we've discussed, don't wait. Call your doctor's office today. If you don't have a gynecologist, ask your primary care doctor for a referral, or contact your insurance company for in-network providers. Remember, taking care of your gynecological health after menopause isn't vanity. It's essential health care. You deserve to live your post-menopausal years with vitality, comfort, and confidence. The key is staying proactive about your health and never assuming that symptoms are just part of aging. Your health is an investment, not an expense. The time and money you spend on preventive gynecological care now can save you from more serious, expensive, and life-threatening conditions later. You've worked hard to get to this stage of life. Don't let preventable health issues rob you of enjoying it to the fullest. I hope today's video has opened your eyes to the critical importance of continuing gynecological care after menopause. Remember, your health doesn't pause just because your periods have stopped. If anything, it requires more attention and care. The key takeaways from our discussion today are: post-menopausal women actually face increased risks for several gynecological cancers. Many post-menopausal symptoms are treatable and don't have to be endured as normal aging, and regular gynecological care is essential for early detection and prevention of serious conditions. If you found this information valuable, please subscribe to VitalHer and hit that notification bell so you never miss content about women's health. Your subscription helps me continue creating educational content about topics that matter to women's well-being. I'd love to hear from you in the comments below. Are you staying current with your gynecological care? Do you have questions about post-menopausal health? Share your thoughts and experiences. Your comment might help another woman who's facing similar concerns. Please share this video with the women in your life. Whether it's your mother, sister, friend, or colleague, this information could literally save someone's life. Thank you for watching, and remember, your health is worth investing in at every stage of life. Until next time, take care of yourselves.